What's up guys, C-Money RN here. I know it's been a while since I made a video, but I figured that this video in particular, because the topic is so important this year in 2020, COVID-19, I had to make it. And in this video, I just wanted to talk to you guys about something that finally happened to me that I didn't expect would happen to me, and that is I tested positive for COVID, and I'm going to tell you the whole story. Welcome to the episode. About a week ago on the 18th, which is a Friday, I actually gotten the COVID vaccine. And the good thing about the COVID vaccine, it was offered to all healthcare workers. The first couple of days, I got the side effects that you'd expect from getting the COVID shot, which is a sore arm, some mild aches, some headaches, and that's what I had. And so I had the side effects, it went away, and I thought I was gonna be good. So fast forward, Saturday, December 26th, that's when I noticed something wasn't, coming right. That was when I was beginning to have fevers, chills, increased headaches, and this increased body aches. I remember I was just in bed under a blanket, I was freezing cold, and I was calling my girlfriend, I was telling her, I'm in so much pain right now, and I am freezing. I'm wearing layers upon layers, yet I'm freezing cold and I don't know what to do. My girlfriend suggested, Christian, why don't you get tested for COVID? And I thought maybe this could just be some side effects from the vaccine. So I didn't really think much of it. I should have done it sooner, but I kind of took it another day and I waited till Sunday, the 27th. And that's when things got even more worse. So imagine those symptoms that I just listed out for you guys on that day times two, increased body aches, increased fevers. I remember my temperature spiked as high as 101.7, and I was suffering even more. At a point where I was just stuck in bed, and I was in so much pain from all these body aches, and it hurt to move. And every time I had to get up to go to the bathroom and walk back to the room, I was just in so much pain, and I was so weak, and I was like, you know what, crap, this does not feel right. I need to get tested. I need to do something. And so the Monday after, which was the 28th, I decided to go urgent care clinic because my friend told me that I could actually go there and get a rapid test, if I was able to justify the reason for it. So I went to the urgent care clinic. I told them my textbook symptoms, what I was feeling and everything. I told the MA, I talked to the doctor, and the doctor said, you know what, we're going to test you for COVID, but first we want to test you for the flu shot. So we're going to swab you for the flu because the symptoms between the flu and COVID are very similar. They tested me for the flu, they swabbed me, negative. And then after that, they tested me for COVID. They went really deep into my nose, swabbed both sides, so extra swabs, and slowly but surely I ended up getting tested positive for COVID-19. Something that I could not imagine. I thought I was going to evade the entire year of 2020, but I ended up testing positive. So the doctor ordered me from onset of symptoms, so from that Saturday, the 26th, 10 days, I have to self-quarantine at home. I cannot leave the house. I need to stay in my room. I can basically only go in and out of the bathroom, just to use the bathroom. And so basically, as I'm making this video right now, guys, I'm stuck. I'm confined in my room, and I just wanted to share my experiences, and I'm gonna go day by day explaining to you how COVID has affected me. And one big difference today, compared to those last 2 days, guys, is that I actually started to lose my sense of taste and smell since yesterday. So my girlfriend had brought me a smoothie from a care package, and I had drinking the smoothie, and I couldn't taste it at all. And I couldn't taste the dinner that my family made for me. I couldn't taste the chocolates I had in my room. I couldn't taste anything, and it was the weirdest feeling. Can you imagine, you taste everything in the world, and it's just all bland to you? You could probably have the worst tasting thing, you can probably not even taste it. Just now, I just had some pizza, and I had some Pepsi, and I couldn't even taste it all. I even had a green smoothie, and I couldn't taste it. So, these are the symptoms that I'm feeling, but thankfully, as time has gone, it's kind of like a trade-off. So, no longer I can say I don't really have too much fever. I don't have fever at all, actually. I don't have the same body aches as I had the last couple of days. But instead, I just have this loss of taste and smell. I have this congestion. And I have this really bad cough with a lot of mucus. To a point where every time I'm talking and as I'm making this video, I'm actually kind of getting short of breaths. What's up, everyone? It is day 5 since I had the onset of symptoms, and today I still have this cough which I've been dealing with for the last 2 days. And this cough has, you know, it's been really on and off. Like when I would wake up in the morning, you know, it's not there, but then during the night, for whatever reason, it's just becoming a lot more apparent, and I keep coughing, and I have a lot of this mucus that's built up. That's what's causing me to be so congested, and I feel it right on the back of my throat, sometimes in my chest. And so today my mom, she went ahead and picked me up some Mucinex DM, which contains some guaifenesin, which is the expectorant to help, you know, break up those secretions, and also the dextromethorphan, which is a cough suppressant. So those two together makes the Mucinex, and it helps me with the cough. So I'm planning on taking that right before I sleep, so I could just sleep with no problem. In addition to that, I want to show you guys additional medications that I take to help me treat COVID, because as you know, COVID's a virus, and with viruses, there is no cure, there's no medications. So all we have right now is the vaccination, and knock on wood, hope that the vaccination works. But even after taking the first dose of the vaccine, technically you're not going to develop any antibodies or immunity until you get the second dose of the vaccine, and that still takes about 1 to 2 weeks after you get that vaccination. So is it possible to get COVID? Look at me. And I read articles, I read just about 2 other nurses, not exactly where I live, but in other places, that have also gotten COVID after getting the vaccine. And so it is indeed possible. It just means you just need to be careful, wash your hands, and take care of yourself. I work in healthcare, so I work in an area that's very high risk. So even if I'm not working with patients that we don't think are COVID positive or don't even have COVID at all, you know, they may very well have it. We'll just never know until we test them or we suspect their symptoms. So besides the Mucinex, I also have vitamins too. I'm taking vitamin C. I take 1 of these a night. I take a calcium pill, which contains some magnesium, and I also take a vitamin D pill. So these are medications that doctors have often been giving to patients at my hospital, vitamins that kind of help boost their immune system. So I'm taking a combination, take them all 3 every single night. And in addition to that, if I really need to, like, because I remember the last couple of days it was very hard to sleep, I do have the Dayquil and the NyQuil, which my girlfriend bought for me. So I'm taking that every night just to help me sleep. And ever since I kind of taken the NyQuil, and also since my symptoms have been decreasing slowly but surely, I have been able to get a lot of better sleep. So last night I was able to get my full 8 hours of sleep, non-interrupted. I didn't have to wake up. I wasn't getting any cold sweats or anything like that, so thank goodness. So I no longer have the fever. I don't have any chills or body aches, but like I said, I still have this cough, the congestion, and of course you can't forget the loss of taste and smell. 4, 3, 2, 1. Happy New Year! Happy New Year! Today is Saturday, January 2nd, and it is day 8 of my 10 days of quarantine. So I'm almost done with quarantine, everyone, and I have to say I'm feeling a lot better. I know every day has been improvement after improvement, so I feel so much better compared to how I was the very first day. I just got my oxygen meter. I'm at 98% right now. Oxygen is fine at room air, even as I'm talking to you guys. I'm not as out of breath as I've been before. Still have the cough though. That's been an ongoing problem, so I'm continuing trying to take some cough medicine and also some cough drops just to keep this cough to a minimum. In addition to that, good news, I am able to taste now. So I have this Oreo right here. I'm actually able to eat and taste the chocolate for the first time, so that's a big update, you know, compared to the last couple of days. I couldn't even taste anything, so that's a big improvement. I can taste the Oreo. And then second test, take a sip of this. And I actually taste the orange in that. Luckily for me, now I have this ability to taste and smell again. It is day 10 and it's my last day of quarantine. So it's starting tomorrow. I could finally leave this room, start going outside, start working, do what I gotta do. I am officially done. And if there was a big takeaway that I can get from these 10 days of quarantine, it's that, you know, you gotta be very careful. I thought I was very careful because I have avoided COVID the entire year. You know, COVID started to first come out during January, and from January up to December, I've been very careful. I've been washing my hands, I've been sanitizing all my clothes, I've been wearing masks, I've been wearing gowns, and I've been very careful throughout this entire year. So for me to get COVID at the very last week, literally, of 2020, just goes to show how, you know, how careful that you need to be, especially when it comes to washing your hands, taking good care of yourself, taking your vitamins, taking care of your immune system. Maybe I had one sort of slip up, that's what caused me to get COVID, but now that I got COVID and I got to really experience what it was like for the very first time, I now see and understand, you know, how much of a trouble it is to people that get COVID. Thankfully, I don't have any comorbidities or any health issues that involves my lungs, any lung issues, so my COVID wasn't as extreme as the people that I take care of in the hospital setting. But regardless, I did still have the symptom. I had the fevers, I had the chills, I had the cough, I had the loss of taste and smell. I had every single symptom you could think of when it comes to COVID, and it is finally just put behind me. All I can say right now is I have a slight cough. But other than that, I haven't had to take any medications. I feel way better than I have the first couple of days when I first had COVID, and I could finally just sleep easy knowing that I feel a lot better. So, it comes to the question, am I going to continue getting the vaccine? And my answer to that question is yes. Research shows that even if you're feeling sick, you're not feeling well, you should still get the second shot because it's going to help you develop those immunities. Luckily for me, this thing had timed out perfectly so that I was able to finish my 10 days quarantine. I feel better, and now I feel ready to go get this second shot. And once I get the second shot, that's when the game changer starts. That's when I could start developing these antibodies so that I could finally develop some immunity towards COVID-19. For this new year in 2021, I'm super excited to go back to work. I actually miss work, and I'm excited to go back into my clinicals. So this week actually marks my first week of second semester of FNP clinicals, and so this semester I get to do 180 hours of clinical. In addition to that, I get to learn more about nursing informatics, as well as I get to learn more about pharmacology. Wish me luck. I'll continue to pump up videos every week, every other week. I'll do my best to bring out content for you guys to kind of just give you perspective on what it's like to be a FNP student. And thank you so much for all of your support and following me along this journey. And thank you so much for just supporting the channel in general. Oh, and one last thing. I have to say thank you so much for my support system for helping me with this COVID hub. Especially my family, who's been, you know, my rock and my foundation this entire time. They've been, you know, helping me eat, bring out food whenever I'm sick. We have this whole delivery system where they put it on food on a tray, put it in front of my door so I can eat, bringing me water, giving me medicine. And also thank you to my girlfriend as well, who has been also taking care of me and FaceTiming me every day just to help me keep my sanity in place during this COVID-19 lockdown quarantine session. So especially thank you to them, also my friends for their support too, for kind of just talking to me, motivating me, getting through this hump, because 10 days of quarantine was not fun. And when you're doing 10 days of quarantine by yourself, you know, it gets very lonely, it gets very bored. So as long as you have that support system, everything's going to be very smooth. And if someone else in my family were to get COVID too, I plan on doing the same thing for them as well, you know. And I keep implementing the system, this clean system, so then that way everyone gets better and we can quarantine safe and sound. And that's it for today's episode. Thanks, guys.